management, so I just want to clarify with everybody. The station is you're operating the AED and you're managing the other imaginary people that are there. So one of the first things I want to clarify, because it is a little different from some of the information presented in the book, is you don't ever check breathing and pulse in this station. There was a time where they would have you as the person entering the scene. You wouldn't necessarily trust what the bystander had done, so you would stop them, you would reassess the patient, you would determine, yes, they truly needed CPR and defibrillation, and then have one of your partners take over compressions for the bystander. However,
So then how are you confirming the effectiveness of the CPR then?
Well, that's when you're checking to see if you're creating circulation, not checking to see if the patient has their own that has returned.
But
so you're not
check that by checking the pulse though?
But they're doing CPR while you're checking.
But if they're doing good CPR, you'll get a pulse.
Yes, but that's not what you're checking there. You're checking to see if their compressions are creating circulation. When they talk about actually reassessing breathing and pulse, that's to see if their own pulse has returned. And that you're not going to check again. So when you first enter the scene, you're simply going to walk up. Did you see this happen? How long has the patient been down? How long has CPR been going on? You're going to then say, okay, I'm going to have my partner jump in and begin compressions on this patient. Power on, attach the electrodes, stand clear, analyzing, stand clear, shocking, push the button. All right, back to chest compressions immediately. I want to upgrade my airway with an OPA, NPA, bag mask, positive pressure ventilation, 15 liters per minute. I want to make sure those breaths are creating equal bilateral chest rise with no rise and fall over the epigastrum. And I can also auscultate lung sounds to verify that. I want to make sure another EMT gathers information about the event from the bystander, the lay rescuers providing CPR, any family, friends, or witnesses of the event. I then want to ensure that CPR is continuous without any prolonged interruption, and I want to verify its effectiveness. So am I feeling an artificial pulse being created by those compressions, and are they at the right rate and the right depth? Then 2 minutes has gone by. Stop CPR, we're analyzing now, stand clear, and we get a shock advised. Stand clear, shock, back to chest compressions, ventilations. I'm going to continue to make sure the compressions and ventilations are adequate. They continue without any prolonged interruption. I want to get the information from my EMT who was talking to the crowd, talking to the bystanders, and see if I can get a basic sample history. And I'm starting to now think about transporting this patient. So is my transport available? Can we start to get the packaging material available to do it? And as soon as we have the patient packaged, we're going to contact online medical control and ask if they'd like to continue additional shocks on scene or if they want me to transport now. Because the benefit of staying on scene is that once I'm en route, I can't get any AED. I can't shock the patient unless I pull my ambulance over every 2 minutes. So I want to, if at all possible, stay on scene until I can get a return of spontaneous circulation. But if that doesn't happen in an 8 to 10 minute time period, then I've got to package and go. And that's what they're trying to make sure that you can realize is that there's a need at some point to package and go and not just continuing to shock this patient. Now there's a lot of question, what comes up when you get a no shock advised? You go straight to CPR with chest compressions. You don't go back and check breathing and pulse. And that happens a lot, and it probably shouldn't, and I'm not going to absolutely fault anybody for doing it, but if we're sticking straight to the guidelines, we don't recheck breathing and circulation, whether you get a shock advised or a no shock advised, because typically right after shocking or no shocking, there isn't one, and you need to get onto compressions in order to create that. So what we're looking for is actually a patient begins to purposely move or wake up while you're doing this, and then we can stop and actually recess the quality of circulation and breathing.
So the book is wrong.
Yes.
So
the book is also wrong when it says to attach the AED and then turn it on, then attach it, then analyze, then shock.
but let's say both of those are on the test and we get them wrong from the state level, because it's the same test.
You just gonna throw it out, you said.
No. The questions from our book are from a test generator created by the textbook publisher. The state is the one that creates the standardized test. It's actually a national standardized test.
So who does the state go by? The book, or
No,
just?
it goes by well, no, the book. There's no book. There's several books. There's about 10 different books that the state says are good books to use for EMT training, that follow the guidelines very closely as to what they teach.
These are the skill sheet, they're gonna use that.
No.
Yes, and that skill sheet does have it being done that way.
Okay.
That's why we're following these skill sheets to the letter of the law.
You said reassessing airway or
Breathing and pulse. Mm-hmm.
Where?
You don't.
Honest?
No, you
Because I
don't.
don't see it on here.
It's not on there.
Just the only reason we're checking pulse is like you said.
To see if the compressions are effectively being done.
And even then you're saying we don't do that, we're gonna advise somebody else to do it?
You can do it, or you can use one of your multiple imaginary rescuers, as long as it's being done. Okay, so, oops, Nancy, you put my stuff away. Where'd she go?
Say hi to Andrew.
Where'd you go? My stuff's all put away. Yeah, I do. I need stuff out. I turned around and it was all gone. So, you asked me to do one demonstration on
Yes,
medical.
please.
So, for those that want to stay and see me do one in these last few minutes, I will.